the shares on and Maureen. I know Emily's been going through quite a bit, so I don't know if she'll be able to join us tonight. Gloria, did you hear from her?
I did not hear back from Emily.
All right, so we'll go ahead and start. So we wanted to, stuff has been going on, and we've been recruiting all along. We had a lovely event at the school district, the high school, a couple weeks ago, and enrolled a couple of families there and answered questions. So the timeline is we've been in the field a year with recruitment. And we're just a little over 500 total enrolled, combined with the two communities. So the leases for the clinic site are up the end of April. And there is, for the science, there's what we call a shutdown procedure that takes about a month. So it means that, actually a little over a month. So March 4th would in essence be the last date we would have available to do a clinic visit at the Hoosick Falls site. And so what we're getting ready to do is one last, and enrollment and recruitment has, over the last couple of months, we've seen a pretty significant drop in interest, which is to be expected. We've been in the field a year, we've been out there a lot, we've got a lot going on, but we're about ready on hopefully this early next week, send out what we refer to as a last chance postcard. It just says, hey, it's kind of like the public radio announcement where, this is it. If you want to participate, you need to call us in February, by February.
I can share it if you like, Dr. Bell.
If you can put it up on the screen, that'd be great for you. Just to let people know that if they want to get in, now's the time. We've got people on board, but this is the postcard that's going to go out to the community. And we're also, I signed the paperwork today for advertisements in the local newspapers. We'll also get this up on our website, and then we'll send, social media with our contacts, and Lorene will ask you to share with your folks too, just to let them know that we're from this standpoint, this phase, which means that the phase where we're recruiting people and gathering the questionnaire data and the blood will end the beginning of March. We are almost caught up. We have another batch of the clinical results letters going out next week, and the final batch of getting completely up to speed, up to date with all of the enrolled participants will go out. I think there's a second batch right after that. And then we are very close. Well, let me inhale for a second. So let me stop with that mode. So that is where we are in terms of recruitment. So any questions on the clinic side of that? And so if for your contacts, as you're talking to folks, let them know that if you know of folks that have been wondering or kind of on the fence, that this is the time to do that.
Make sure that goes up on social media too.
Okay, yeah, we'll definitely do that and share that with you. So it's kind of like the last really big push to get people in.
It's a hard time too with it getting so cold now.
It is, and with I'm sure March will be kind of stormy too. So that's all the more reason to try and get people in with this piece of what we're doing now. We've told you all along, we are still working on this option for people who could not participate because of their occupational status or because they're a firefighter. And we have a meeting later this week. So that will still happen at some point. We don't have a date yet. So if you get questions along those lines, this doesn't mean the end of our involvement with the community or certainly with the firefighter and the occupational workers, or with the community as a whole, because now we transition into gathering our data, getting it ready to do the statistical analyses, and then coming back out to the community and working with all of you as we do those analyses and letting you know what we're finding, and getting feedback from you. Related to that, as I was started to talk about, we've been mailing out the results letters. I did a little video that I think we sent out on social media last week explaining what was in the results letters for the individual results. We're almost caught up, meaning almost everyone, I think now we're on early fall, so the people who came to visit us in early fall will be getting their results letters in the next week or so. And then we're getting close to being able to mail out the PFAS results. So that's the letter number 2. And that should happen. And then as we're working on that whole process and getting those results in. So again, and then hopefully before I would hope the end of November, we'd start rolling those out, or November, the end of February, we'll start rolling those out, but we'll keep you updated on that piece of it. And then the metals will be later, that we're also measuring in that'll be the 3rd letter of results that people get is from individuals on that. Any questions on, have you had any results, questions from people or feedback from yourself?
I can tell you that my daughter and I have been to several doctor's appointments and brought those results letters there, and they were very impressed with them.
Good.
And
All
it
right.
was information they needed, so that worked out really well.
Oh, that's good to hear.
And it led them finally to ask me questions about PFAS. So that was like a great step also.
Okay. And did they ask anything or say did they want any more information, or did they want to be referred to something, or?
Well, they're specialists, so that's hard to say. I just switched to a new GP. I've only seen her once. I go back to her in March to talk about that part more. But no, this was a rheumatologist for my daughter. Okay. And she's out in near Round Lake, Malta. And we talked about just mentioned the PFAS and the results, and she says, "Where are you from?" And you say Hoosick Falls, and her face just crinkled, like you know, like we get it all the time. But like, so they're aware of it, at least the issue. Yeah. And it was encouraging that she asked me some questions. So doctors are waking up to it. That's great. Yeah, no, and so we've been. One of our other partners, a pediatrician, has asked if we would write like a introductory letter that the participants could hand to the doctors in addition to the results that maybe describe the study in a little more detail. I didn't know if you thought that would be helpful from your perspective. Well, we could try our hand at something and float it by you. I think that the initial letter you get with the first round of results letter explains at least what the study is, because that's what that was her first question, is what is it for? And so the sheet adequately described that. To have, something else to bring to a doctor you're just seeing for the first time who doesn't know about PFAS, we have to go and do our own research for that and print off something. I don't know that would be in your arena for this.
So almost like a fact sheet for the doctors.
Yeah, PFAS, but it's not, you can get it from Silent Spring or PSU or wherever they have the fact sheets.
There, we could look at, that in essence, that's what's supposed to happen from ATSGR, right, with this NASEM report, but in the meantime, we could look at least provide a list of websites and have, we have some fact sheet like information that we have pulled together that we can certainly include with some fact sheets. So we can look into that, and that just might be useful for people to have in general. I've done a number of training seminars with the clinicians at Southwest Vermont, as well as with some of the clinicians in Newburgh. And you listened to the one I did 2 weeks ago for the Villanova group.
Yeah, that was great.
We're continuing to do work like like that as well, but we can look into providing the equivalent of a clinical fact sheet for the clinicians if they want more information on PFAS with that. What we'd like to do, I mentioned that, the second letter, which is the PFAS results. So what we're measuring in the blood, we'll be mailing out. We would like to do the same thing we did with the clinical results, and that send all of you send you your letters first, so that you can give us feedback and making sure that they make sense and that it, catch anything for us, if that's okay with all of you. So we'll put you in that first group again, to give us feedback, and we'll give you a heads up. I'll have Gloria email you when they're about ready to go out, so that you know to look for it. And again, tell us to say, make sure it's not taking too long to get to you. And once we mail them, and then any thoughts and feedback on the actual letter would be helpful.
Remind me, Aaron, how many PFAS did you test for in the blood?
12.
12, okay.
Yeah, I can double check. We can put that up, but I believe that's what was on our list with that. So, and a number of our participants out of Who's It Falls, actually also in Newburgh, have previously participated in biomonitoring. So one of the pieces we'll have in that letter is to clarify, because for those who did previously participate, to make sure there's not confusion with that the language is similar to what you see for the biomonitoring, so we aren't contradicting language or using vocabulary that's different, and to provide people that option. So so your feedback on that will be very helpful.
Okay.
There's that piece. We'll continue. One of the things, once we do wrap up with the clinic, and we'll want to continue to meet with all of you, because then we need to plan how best to have meetings with the community members to let them know how analyses are proceeding and what we're finding, both with our New York State only analyses, but also the national analyses. It's going to take a while. It always does to get, first of all, the different sites are concluding their recruitment at different places. So I think some will be recruiting throughout the summer. In Newburgh, our clinic site lease is also closing the end of April. However, if we can find some additional funds, we would like to have some options open for members of that community for a couple more months. There are pockets in that community where it's been difficult for them to get to our clinic. So we want to make sure we have some options and we give them a little bit more time, because it has been a little bit harder to recruit there for a number of reasons. And so we want to try a couple of other options. So they might be open a little while longer if we can make that work logistically. But once all of the sites are done recruiting, then we will start working on compiling the data for the national component of the statistical analyses. We'll be able to start maybe looking at some things for New York State before then. And certainly we'll keep you apprised of that as we keep moving.
I saw that the folks in Pennsylvania are adding additional numbers because their response was so overwhelming. So hopefully that'll make up for what we lacked up here.
I think so, and we've talked a lot about that with Pennsylvania. So Pennsylvania had not done any biomonitoring, or very limited amount of biomonitoring before. So this was really, for a lot of people that participated, their first opportunity to do that. It was also a much larger population size that they were working with. So yes, they've been able to recruit quite heavily. For adults, they're struggling with children like we all are. What we've all advised is that there be an additional study for children, focused on children, because that's really the best way to do it for those of us who have done studies on children. I don't know if APSDR will move in that direction. We'll try to find out more with that, but the sites are all have a very small number of children enrolled, and that's not surprising. given the length of the protocol and how much we're asking of people. So we're gonna bring that to ATSR as well, aware of our concerns around that. And so we'll continue to keep you apprised of that as well. So it you know, again, this phase is why I keep referring to it as a phase, because this phase, the clinic will be closing down, but it is quite possible we might be opening up for some version of children moving forward, and definitely we're moving forward with opportunities for occupational workers and firefighters. And so again, in the months to come, we'll keep you apprised of those, because that'll be very important as we move forward.
Kind of a shame that the children's numbers are so low, but I get it.
Yeah, you know, it was explained to me, and I don't know how accurate any of this always is that, you know, they knew they need to study children, so I think they were just trying to just put it all together. And yet, for those of us who do this for a living, you see, you know, it's just much easier if you have separate studies and you know, focus on, you know, maybe do adults first and then children, or you could do mothers and children, but you target that group much more differently. You focus your protocol and streamline it in a way that makes it much easier for families to participate. And so we'll see, because there's a great deal we need to learn about children with this. And again, this speaks to what I do. This is my particular area, and the evidence and again, the NASM report pointed to this. There's still very mixed findings when it comes to neurodevelopment in children. We know there's a concern, clear evidence on the antibody response or the lowered antibody response, but we need to understand the long-term effects of that. Same with the cholesterol. So there's just a lot we need to better understand with the kids, and it's going to take an additional effort with that. So hopefully there'll be some additional funding coming and an emphasis on looking at the children.
Seems there have been quite a few studies coming out on childhood obesity as well with the PFAS.
Yeah, and it's funny, I was just talking to one of my graduate students today about that. We looked a little bit at that with the newborn blood spots, and we had it's a statewide and very low level of exposure. And but it is very much of interest to NIH in terms of the relationship with obesity, because the PFAS and a number of other types of environmental chemicals can have an impact on the hormones, and leptin and is another chemical in our bodies that helps us regulate eating and diet and nutrition. And so there is a concern that it might be yet another thing that's related to obesity in young children. So there's definitely a biological mechanism that could be at play here based on some other information that we know. When you look at endocrine disruptors, they can be associated with an increased risk of obesity. And the fact that these chemicals seem to be related to lipids points to the fact that they're certainly impacting, you know, the cholesterol, but other aspects related to nutrition and diet and body weight. So there's definitely concern there. So again, there's just a lot. So my hope is that there will be additional funding opportunities for that, and then obviously the breastfeeding question, which is.
There was a study out just this week on that. Did you see it?
So that I haven't read it yet. I saw that it came out. Did you get it, or do we need to?
Yeah, I tweeted it if you want to grab it off my page.
Okay, all right.
Just today. I think I tweeted last, but I tweeted it again today because it came up as in case you missed it. So I just popped it back on. And basically all it says was the higher exposure to the mother is breastfed into a higher level into the baby, which we kind of knew, but it confirmed it, you know.
Yeah.
Another confirmation of a problem with breastfeeding.
Right. And it confirms the recommendation that if a woman's trying to decide that, you know, getting her measurements would be perhaps a way to help make that decision.
Right.
And at least until we have better information. So I'll pull that out. Thank you. We can make sure that gets up on the website. Are there any questions, ideas, suggestions?
I think a simple fact sheet would be helpful for doctors, but you know, time is so limited with them. You have 10, 15 minutes and they're off to see someone else. So something short and sweet. My doctor, who was in Troy, my GP, he knew all about it, but you know, he's in the area. Kathy's going to her yearly thing tomorrow. She's going to talk to her doctor and give the papers and maybe see what she thinks about a simple fact sheet. So
Okay.
maybe
All right.
we'll have some more information.
Yeah, we can look at that and again, we'll keep trying to, as we listen to ATSDR, what they plan to do for their clinical guidance. We're waiting to hear how they're gonna respond with the nursing report and their new guidance. But we can certainly pull what we have together with a list of resources that people can use their handout.
The other thing I'm gonna look at, sadly, that I know these chemicals. I hate that I know all these chemicals, but like if there's a certain amount of one that shows surprisingly higher than we expected, did we get it from the simply orange juice that was just in our refrigerator kind of thing? Or, you know, or can we pinpoint where these chemicals are, whether it might have been a food packaging something, or, you know, I'm really interested in that.
Okay, yeah, no, that's a good question. So that's the classic exposure assessment and trying to understand the different sources. And we're hopeful, we're actually, this is a good segue, you know, some of the additional work we're trying to do in New York is trying to understand exposure patterns and what contributes to everyone's concentration. So there will be another opportunity for people, you know, again, with the newborn blood spots, we'll be mailing out those letters in the spring, and we can update you on that. But in addition, I think this is a greater question, and it's why we've asked these additional questions on, you know, people's eating patterns, what their food sources, you know, wild game, different products. It will take studies beyond what we have the capacity to do right now with what's been designed for the multi-site study. It'll be more detailed questions, but these are we can definitely look for more information as that comes out in the literature and get information up on the website. But there'll be additional studies to look at, you know, source and beyond just contaminated drinking water. What are regular people exposed to? And we know the heavy hitters are the firefighting foam with the firefighters and the contaminated drinking water. But once you deal with those two, then what else is going on?
Well, this info is helping us right then pass the bills, like banning it in the apparel and the carpeting. And we're working on 5 more this session. And then I don't know if you pay attention, the toxic children's products proposal from DEC is on the 15th.
Okay.
That webinar 16th. It's on the 16th at 10 a.m. If you need an invite, holler and I'll send you the link. We all had a big meeting on it today because they haven't met since like September of 21. And this bill's been around for years, and we don't even have an update on what chemicals they may have added or subtracted or classed yet. The last meeting, they only had 2 PFAS on it. 2. So I'm kind of hoping in the last 2 years that's changed. Because clearly we're going to go for, you know, ban them all, but it's kids again. So the information we get from the kids being exposed can lead to more regulations so the kids can stop being exposed.
Right. And well, and the other piece of that are the replacement shorter chain ones, as you know, and you know, the issues in North Carolina, some of the papers that are coming out of North Carolina are suggesting similar health effects, even though.
Right. And then I don't know if Kathy and I dig into this as much as I do, but the EPA finalized their PFBA assessment, toxicity assessment, and it was for oral only. And guess what? It's toxic. Development, neuro, and liver, I think were the biggies. And yet, you know, that's the one chemical that they find most according to DEC charts and all the presentations they've had, goes PFOA, PFOS, PFBA. That's the next highest one they find in all through the state water testing. And yet, for the New York State Drinking Water Council, they've only suggested to notify people if it's in their water after a certain point. But yet it's the most found after the toxic 2. And so that came out, and see, that's being substituted, the C3s and 4s now for everything, but in triple the amounts, right? Because they have to make up to a C8 what it used to do. So it's all, all so concerning.
Yeah, and and again, it's why the committee recommended in its clinical guidance to sum the total concentration of all, in terms of its recommendations, rather than try to piecemeal it out one by one.
And we bring that up every time we meet with people. Every bill. Did you see the NASM study?
All right, no, that's good, and I'll see if we can get, if I can attend, maybe one of our staff can attend on the 16th and listen in, and take some notes and keep track of that. But we can definitely keep you updated as the exposure assessment work continues on. And we have other folks here at UAlbany working on some of the source information and how to deal with some of the exposures in the environment as well as detection. So we can keep in touch with what they're working on and let you know too. So we'll keep up on it. So that, again, we've made a commitment with both communities that we'll be here as we're continuing to do the research, and as we have additional funding opportunities that come along. And I may be reaching out to see if you would like to participate and would like to support us in that, and I can let you know that.
I think it'd be really important once we have all these results to continually keep finding where this stuff is and get it out of our home. I just threw away Simply orange juice last week that was in my fridge, and it pissed me off. Every other week I'm throwing something more out. It's getting costly, by the way. Ceramic and cast iron, that's not a cheap stuff. But when you're spending, with the prices of things right now, I just had to dump a whole thing of orange juice. Really pissed me off that there's PFAS in it, So to me, to take these results and say, okay, I might have gotten, or I can lesser my amount by getting rid of this in my house, that I think would be incredibly helpful too, because we don't know where it's all coming from.
Right. And it's not all tested.
Right. And nothing's labeled, that.
Okay. Yeah, we can definitely keep an eye out for that information and keep posting it as we learn it and use our own sources to try and get information. But it absolutely is, it's the number one question: how do we reduce? And in order to reduce, you have to identify.
Right.
Okay. Anything? That's all I have. I wanted to update you. I wanted to definitely update you before we started sending out these postcards so that you were aware of the timeline. We'll definitely update you, give you a heads up when the PFAS letters are ready to start sending out. We'll send those to you first. And then probably in another month and a half or so, we'll have a CAT meeting to kind of give you the plans for the summer as we'll have clear understanding where the other sites are in terms of their recruitment and what the timeline is for analysis. And I mentioned this opportunity. Some of the folks I've been working at the University of Connecticut are interested in exploring the immune-related impacts of PFAS. So we might work with them on a sub-analysis with the people who have been enrolled in our study, from Hoosier Falls and Newburgh, and potentially some new people as well. But if that if we start discussing that, that would be a grant that wouldn't go in until fall. So I'll give you a heads up and get your feedback on that to see if it's something that you think people might be interested in. If we do participate in that effort. But I'll definitely keep you updated as other things come along, as grant announcements are going. The good news is there is a lot of attention on this right now at the federal level, at both the EPA and ATSDR and then in Congress. So my hope is that this will loosen up some more funds so that we can do more on what they're looking use directly. And you know how to find us. So feel free to email or call. I'm happy to come out. I'm sorry I missed the meeting last week in Petersburg. We did see the article and I saw the news teams were there. You know, I knew that was coming. So but if you need us, you know, just let me know.
Yeah, and anything you need, Aaron, we always hit us up. If you do an immune study, sign me up. I'll be your first poke. My oncologist calls me a walking immune disaster. So
Optimistic. But I appreciate that. Well, I'll definitely keep you all posted if that comes to be, because we'll need some input from all of you on how best to proceed. But yeah, I think you need, and Lorraine, if that group does want me to give a talk, or just even a Q&A.
yeah, we have trying to see when our next meeting is. I asked them to send around. Our next meeting is the 1st. So I should hear a consensus by then, and then I can let you know.
Okay, well, that's all I have. So thank you all. Stay warm. I think winter is supposed to arrive on Friday.
Yeah, 25 below with the wind chill Saturday morning.
I missed it. So anyway, but stay warm and do email us or give us a call if you have any questions or ideas or feedback that we should know about. So
Great. Thank you, Aaron. Thanks,
Thank you.
Gloria.
bye.
Thanks, everyone. Bye-bye.
Thank you.